Most adults will have swollen legs at some time. Leg swelling is fluid accumulation in the tissues of the legs. It is also called peripheral edema. Leg swelling can be totally harmless, for example, due to prolonged sitting, or life-threatening, for example, due to deep vein thrombosis. That is why we will discuss how to identify the true causes of leg swelling. The most common cause of leg swelling is dependent edema. It usually affects people over 50, impacting 1 in 3 older adults. This condition causes swelling in both legs, especially in the evening. It is common among those with sedentary lifestyles, such as prolonged sitting or standing.
Gravity pulls fluid into the legs, where it accumulates in the tissues. Swelling improves after sleep or elevating the legs, and is typically pitting edema. It means pressing a finger on the swollen leg leaves an indentation, which confirms pitting edema. If swelling reduces in 20 to 30 minutes after elevating the legs, it is likely dependent edema, although other serious causes should be excluded first, like heart failure or kidney problems. The second most common cause of leg swelling is venous insufficiency. Swelling is often asymmetrical and affects one leg more than the other. Swelling improves with leg elevation and worsens with prolonged standing or sitting, because during venous insufficiency, venous valves are not closed properly and blood flows backward in veins pooling. If skin becomes brownish, itchy and scaly, it also indicates venous insufficiency, because venostasis causes red blood cell breakdown and hemosiderin deposition in the skin.
Patches on the leg are also a sign of venous insufficiency, because impaired blood flow causes poor healing. And varicose veins are also a key sign of venous insufficiency. Varicose veins are visible, twisted, dilated veins which are visible on the skin. It is a hallmark of venous insufficiency, and at first venous insufficiency causes pitting edema, but over time non-pitting edema develops, which is called lipodermatosclerosis, and skin thickens. This is also because of advanced venous insufficiency, because chronic venous disease progresses to fibrosis and hardening of the skin, creating non-pitting edema, and night cramps and aching pain in the legs that improves with walking or compression is also likely venous insufficiency. This insufficiency is common among women after 40, especially for people who stand for prolonged periods, like teachers, nurses, or factory workers. The third most common cause of leg swelling is injury, like sprains, strains, and fractures. Drama causes local inflammation and swelling. The fourth most common cause is medications. Many common medications cause leg swelling. For example, high blood pressure medications, calcium channel blockers like amlodipine, nifedipine, diltiazem, and verapamil, cause vasodilation and increase capillary hydrostatic pressure, which promotes fluid leakage into the interstitial space, causing edema. Usually, edema is non-pitting and dose-dependent. The higher the dose, the stronger the edema. Also, common anti-inflammatory medications like ibuprofen, naproxen, and diclofenac cause leg swelling, because they block prostaglandins, and prostaglandins are crucial for sodium and water excretion from the kidneys. Eventually, fluid retention worsens edema, especially if the person has heart failure, hypertension, or renal impairment. The common medications that can cause leg swelling are corticosteroids, estrogens, beta blockers, and many antidepressants like monoamine oxidase inhibitors.
The fifth most common cause is deep vein thrombosis. Is when a blood clot forms in a deep vein in the leg. It causes pain, swelling, redness, and warmth in the affected leg. Deep vein thrombosis is dangerous because the clot can break off, travel to the lungs, and cause a pulmonary embolism, which can be life-threatening. Leg swelling is usually in one leg. Asymmetrical. Leg is painful when palpating the calf along the veins course. Superficial veins are more prominent and engorged because of venous congestion. And a person with deep vein thrombosis commonly has a low-grade fever. Sudden swelling is more suspicious for deep vein thrombosis compared to gradual swelling, which is often venous insufficiency or dependent edema. Deep vein thrombosis is more common in people after surgery or immobilization. For example, long flights, hospital stays, pregnancy, or oral contraceptives. Also, in people with active cancer or undergoing chemotherapy, elevated edema suggests a clot, but it is a non-specific sign.
The sixth most common cause is heart failure. Swelling is in both legs and it is pitting edema. It worsens in the evening. Swelling can also occur in the abdomen due to fluid retention. Shortness of breath, especially when the person is lying down, is called orthopnea. And paroxysmal nocturnal dyspnea is a hallmark of heart failure, where the person wakes up gasping for air. Fatigue, weakness, and reduced exercise tolerance are also common. Heart failure is more common after the age of 60, and in people with hypertension, coronary artery disease, or history of heart attacks, diabetes, obesity, and heart valve problems. An echocardiogram is a crucial test in this case to evaluate heart function and ejection fraction. The seventh most common cause of leg swelling is kidney problems. During kidney disease, swelling is more generalized in the legs, around the eyes, and on the face. Swelling is more prominent in the morning. Urine amount is reduced, or the person may have foamy urine, fatigue, nausea, and itching occur due to uremic toxin buildup in the body. Pale skin and anemia can highlight kidney problems due to reduced erythropoietin production. Kidney problems are more common in people with diabetes and uncontrolled hypertension. Chronic dehydration is a risk factor, as is the use of nephrotoxic medications. It is more common in advanced age. Serum creatinine and GF are crucial to assess kidney function, and other causes of leg swelling are liver disease, lymphedema, and cellulitis, which is a bacterial infection causing localized redness, swelling, pain, and warmth. Generally, these are rarer compared to the above-mentioned 7 causes,